Good afternoon. Thanks for tuning in today. We're going to talk about virtual care as a health service in Alberta. We'll look at some health service codes and how communication structure can help support that. Um, so we'll dive in. We've got a half hour today. Normally with these virtual care webinar series, we do a 15-minute, but there's a lot to cover here today. So we'll extend the time a little bit, and we should definitely be done by 12:30, if not before. So let's dive in here. We're going to talk about patient-centered virtual care, what that system looks like, how how to sort of build the components of that out, and what you should be looking at when you're doing that. We'll talk about some of the health service codes, some in more detail than others, because there is quite a range of variability in terms of how to do it, what qualifies, and different modifiers. So we're not going to get into all the modifiers today, but of course, you can look that up on through the AMA website. Virtual care workflows for patient management is kind of the big thing we'll be focusing on. We've been touching on some of that stuff in the last few weeks, but we'll really look at how that applies now, looking at the health services. So looking at how to build out a virtual care system, it's interesting, probably as short as 2 or 3 months ago, everybody was kind of in their heads. You think about virtual care as a video conference is kind of the sort of go-to image that we have in our heads, but there's actually a lot more to it, and we'll look at sort of how what the prevalence of each one of these things is. So obviously, your EMR is part of your virtual care system. That's where you're going to access, maintain your records. You're going to put your encounter notes, and it's it is your EMR, so you need to use it for your records when you're conducting care and tracking that care. Secure messaging is actually sort of the foundation of any virtual care system. If you look around the world at organizations that are doing this very, very well and have been doing it for a long time, we'll look at the statistics a little bit in a couple more slides, but 80 to 90% of the telemedicine or virtual care that's being conducted is through secure email type platforms. So we're using asynchronous communication because we don't have to align schedules. We don't have to worry about no-shows. Patients can send questions as they think of them at 10 o'clock at night rather than having to write them down and remember to call the clinic in the morning or something else. Clinics or clinicians can respond in kind. See, the great thing about email is we all understand it's not a real-time communication thread, but it's convenient in that sense because we don't have to have two schedules aligned at the same time to get people talking together. Someone sends a question or some information and the response comes as is convenient. So it's not for urgent care, definitely, but a lot of the care that's provided can be done through this asynchronous means. Phone, obviously, is a virtual care method as well. I know nowadays, particularly, a lot of clinics are conducting virtual care over the phone. If you don't need to see a patient, you can have a conversation, ask them some questions. How are you feeling? How's this going? Then you can do that with the phone. And video conferencing from a virtual care perspective is almost like the final level of virtual care. It's the top escalation for virtual care before you need to bring somebody into the clinic if you really need to lay hands on that knee or that shoulder or feel the throat, look inside the ears, that kind of stuff. Is going to have to be done in person, but video conferencing allows you to look at patients, have a little bit more of a personal connection than you would over phone. The research does show, however, that you look at secure messaging and phone and video conferencing, that a lot of the communication when you code it, when you look at the types of connections that are happening in communications in terms of the salutation or the greeting, and then you move on through the appointment, secure email, phone, and video conferencing tends to closely mirror those in-person visits because everybody's familiar with how those things flow. So when you're looking at selecting the different components in terms of what you're going to use, and this is what everybody was scrambling with back in March when we didn't want to bring people into the clinic. Maybe clinicians are working from home anyway because they're in isolation. They came back from somewhere and now they can't be around patients. There's a couple things you need to consider, and the challenge that we kind of ran into at first was that not everybody knows um, what works, and what's compliant. So privacy compliance is a big issue. We've certainly seen that already in the news. Organizations that have launched different software systems that are weren't necessarily hadn't gone through the necessary processes from a privacy impact assessment standpoint in Alberta, that now are sort of being pulled back. I've seen organizations such as UFC that are now, after some IT analysis, are changing some of the systems that they're using in their sort of on-campus clinics. So you need to make sure that you've got OIPC acceptance of the service that you're using, and you're going to have to update your PIA to say, hey, I'm using this service. Now, I've heard, and I'm not confirming, that the OIPC has kind of said, go forward. They're not going to delay care. They're not going to say, hey, doc, if you're working at home, you've got to file your amendment before you can file virtual care. Make sure that you get the documentation in line as quickly as possible, and make sure that you're in line with the CPSA guidelines. It's really all about making sure that you're taking reasonable measures to protect patient information, and that whatever service you're using is in line with the Health Information Act, and you're going to have an information manager agreement signed with that provider. So there's different things to look at. Examples, something like Zoom, if you're going to look at using that, you're going to have to use the healthcare version. And even then, I think there are some concerns floating around about it, but you're going to want to make sure that they will sign an IMA. I asked them directly if they would, and they said we'll look into it and get back to you, and they didn't. So I'm not sure where they're at with that, but I'm sure most providers are going to be willing to do that and have that lined up. Ease of use is a really big one, because particularly with virtual care, particularly with looking at different populations, older populations aren't necessarily going to be familiar or equipped to hop on a video conference, depending on what technology, if they have to manage any software. A lot of seniors might have a tablet, but they might not have a laptop or a desktop or something that's more capable of handling that kind of software. And think about what people are already familiar with. So most people use email, and that has a lot to do with why secure messaging or secure email is one of the most, or is the most popular way of communicating for virtual care. It's familiar for people, they understand it. You don't have to worry about aligned schedules, that sort of thing. So think about it from a physician standpoint, from a staff standpoint, and a patient standpoint. How quickly can people start using this? Is there much training involved once they start and open up this software? Can they use it to effectively? And then clinical functionality. I think a lot of people were kind of familiar with Zoom and things like that coming into this, because it's sort of a popular sort of feature or function, but it doesn't necessarily have the features that are helpful and sort of required from a clinical standpoint to help manage things, because we know that healthcare communication and the needs of a clinic are going to be different than office workers who just need to get information back and forth. We need to organize things differently. We need to have different follow-ups. We need to have different visibility. We need to have a team-based approach, because that's how clinics work. So things like, how do I enable my team to respond as a team? How do I get my virtual front desk working so that we're not all disjointed and we've got different people answering the same message at different times? How do we track that communication so it's efficient and effective? Can I do things like message recall if it's no longer appropriate for someone to view a message or have access to that information, or if we've accidentally sent something to the wrong person? Sometimes the pace of things get out of hand. We know that people will make mistakes, and that's just a reality. So we need to have some safeguards in place to make sure that we can correct those mistakes and avoid privacy breaches, because it is still an important consideration. Read receipts, we want to be able to close the loop on things. We have clinics that use secure mail for appointment reminders, and once you see the little green box check off, that the person you intended to see that message has viewed it, which is a lot different than a fax machine telling you that the data was received by the fax machine on the other end, because that's not the same as knowing that someone read the message. And obviously, we don't get fax read receipts when we're messaging with patients. So just kind of looking at the prevalence here, you can see when we look at this pie chart, a lot of it is light blue, which is secure messaging. So this is data from Kaiser Permanente, so a very large healthcare system in the US on the West Coast. And this is looking at about 36 million telehealth interactions. So about 32 million of them, I think, were secure email. So this is connecting with patients quickly to send them a message or receive a request for care, or some follow-up questions, or providing treatment advice or treatment notes to the patient via secure messaging. It saves a lot of time for providers. The average time for a provider to send a sort of clinically relevant response to a patient via secure email is 2.3 minutes. You think about that in terms of, if you were to get on a phone call with a patient or set up a video chat, even just, getting to the point where everything's working okay, could take more than that. So in terms of efficiency, it really helps. You can see that phone is sort of the first escalation point. So, if we have to have a conversation real quick, let's, the clinic or the doctor can call a patient, at either a pre-scheduled time or just try and reach out and hope they answer, which is one of the problems or challenges with phone. And we don't have, we don't have the certainty that someone's going to pick up when we call, even when we schedule an appointment. And you can see that less than 0.5% of the sort of the telehealth services that Kaiser Permanente is providing are done by video chat. It's a valuable tool to have, but for a lot of the reasons I've already discussed, aligning schedules, technology challenges, that sort of thing, it's not as efficient as some of the other means that we can use to kind of get people to that point, or deal with issues before they get that big. And research shows that Canadians would like to be able to email their healthcare provider. I think the same study showed less than 10% could, and also have video visits. Right, it is convenient. People see it as a potential opportunity so that they can stay home, especially now. That's hugely important. So there's appetite for this within patient populations to get connected, and we know now that as clinics look for other ways to communicate with their patients and maintain that continuity of care, these things are becoming hugely important as well. I'm going to get into some of the codes now. These codes we'll look at here. I'm going to kind of describe what they are quickly. You can learn more about it on the Fee Navigator, because there's a lot of different modifiers. So depending on how you're executing these codes, how you're using them, who you are, that's going to be different. So just kind of give you a sense of what is possible, and we'll look at how these kind of fit into the structure of your virtual care clinic, or the virtual care aspects of your clinic in a second here. But so first of all, you can do assessment of a patient's condition. That's as little, or it has to be a minimum of 10 minutes for 0303 CV. Then if you get into a comprehensive consultation by telephone or secure video conference. So we've already kind of pre-screened a patient. Maybe they've called in or they've emailed the clinic through secure mail and said, hey, I've got this question. And we've decided that we need to talk to them sort of face-to-face, either on the phone or on video. Any kind of secure video conference, you can just do a 301T. And there's also rules around some of these that you have to be aware of. Like, if you bill one code, you're not necessarily going to bill another code within the same day or within a 24-hour period. And there's a couple other stipulations like that on these. And a telephone call directly to the patient to discuss test results, that sort of thing. And you can also use it. So 0819 CW, that's a GP or pediatrician code to provide psychiatric sort of assessment, reassessment, treatment, that sort of thing. So you can use that code as well. And like I said, there's a lot of different modifiers on these depending on how they're being applied. So the next few codes we'll look at, they are fairly concrete, and they do apply directly to secure mail. So anything else that we just looked at would be something that you would use when you're doing an actual sort of live consultation with somebody on phone or video conference. These ones you can do asynchronously through, sort of a quick secure mail message. And there's some rules about how they have to come in. So this one particularly, this is the pandemic code that was reactivated back in March. There is no cap on this code, but it does have to be patient initiated. So, just going out to all your patients with advice about COVID-19, for example, wouldn't count for this. But if a patient writes in with a question or calls in with a question, you want to respond via secure mail, this is an appropriate use of that code. 301S has been around for 3 or 4 years now. So it's about secure electronic communication. So this is something that you have to be using an OIPC accepted service. So sending a message through Gmail wouldn't qualify for this. So something like secure mail does. There's other services. If you're using it with patients, that could work. As long as it's accepted by the OIPC. So you are going to have to file at least an amendment to your PIA to use something like this, which would apply for any of these codes as well. And you've got to check with the CPSA guidelines as well to make sure that's in line. But if it's accepted by the OIPC, then you're good with the CPSA as well. So this is for medically necessary advice or follow-up that can be managed remotely. So it's about appropriate care. Look at is this a good way to do this? If you're passing on something like a cancer diagnosis, this is probably not the place to do that. This code is available for use 14 times a week. So that was 7 up until I think about a year ago. So 14 times a week. And if you look at that, how it works, you think about if you had 14 in-person visits that you can replace appropriately with a secure mail message. You think about your average in-person appointment time versus about 2.3 minutes to send a response or some advice to a patient. You can see a lot of efficiency there. Some of the calculations we've done have showed, about a 3 to 1 in some clinics or a 5 to 1 in some clinics, depending on specialty or how many patients you're dealing with. So that gives you a lot of efficiency. It gives you some more flexibility in how you can work with your patients as well. And then on top of that, we have e-consult codes. So 301R, if you've got a question about a patient, you're not sure quite what to do and you want to get some other expertise, some input from somebody else, one of your colleagues who might be a specialist or just have more expertise in the particular condition you're looking at, you can shoot a question over to them through a secure means. As long as both sides are using a secure message transfer system, you can bill for this. This is uncapped, but there's no modifier, so it's a quick question back and forth. And it can't be a transfer of care, so this is not just for referrals, or it can't be just to request some diagnostic tests. It's got to be, hey, here's a bit of the presentation. What do you think? And then the response to that is also qualifies as well. So if you're a specialist clinic, you can use this code to provide your expertise and receive compensation for that, as you should, without necessarily dedicating a lot of time to scheduling, bringing an appointment in. You can sort of provide a response directly, and it may turn out that you end up doing an in-person visit with the patient, but this is kind of a first step at screening. If you send back some an opinion, and it comes back that, oh, we still have some more questions, or it's like, here's what I think, and maybe I should really see this patient to be sure. That's the kind of thing that you'd be doing here. So let's kind of look at how this is structured and what the workflows look like around this. We talk about a virtual front desk. So what SecureMail does is allows you to assign any members of your front desk team or your staff to have access to a secure shared inbox. And the difference with that shared inbox is messages are actually addressed to the clinic name. So if someone's in secure mail and they want to address a message to your clinic, maybe they say, hey, I need a renewal on this prescription, or I'd like an appointment, or I have a question about my last visit or my medication, that sort of thing. They actually, instead of typing an email address or an individual's name in the to field, they would just type your clinic name. It shows up in your shared inbox, and your clinic then as a team can address the message, triage appropriately to the right physician, or even, in some cases, respond directly to the patient and get a response that way. So that takes a lot of the load off the physicians, allows them to focus on, actually treating patients and providing advice and exercising their expertise, and it allows staff to exercise their expertise as well, because what happens is, instead of answering the phone sort of every couple seconds, you can manage emails in groups. So, we check the inbox when we come in the morning, we check it again at 10, we check it again at 2, rather than answering phone calls all the time, because the instruction to patients is, this is for non-urgent issues. If you're bleeding, call 911. Don't secure email us. We've never had that issue. I think there's one clinic a couple years ago that did receive an email on a Saturday night with somebody that was having chest pains, but luckily they were okay and everything was all right. But obviously not an appropriate use of the service. So just to kind of look at what that looks like from a workflow perspective, you can see that a patient is going to send a request for care to the virtual front desk through secure mail. Studies show that in regular times, that's going to be about 5 messages a day. So those aren't phone calls. They're going to be somebody just walking into the clinic expecting help right away. So you've got 5 of those, as many as 15 to 20. If it's a really busy clinic that's really done a good job of activating a service like this. And probably, I think the stats show about 2/3 of those messages that come in are going to require some physician input. So everything else, so a 1/3 of those messages are typically addressed by the front desk, and they can kind of respond. If there's no clinical assessment or decision required and the staff knows how to address the issue, they can just do that. They can respond and say, here's your answer, and that's good, and the patient issue is satisfied. If there is clinical assessment required, so do we need to do a real-time investigation? Do we need to get on there and get on a video chat? Do we need to have a phone call about it, or do we need to bring the patient in for some hands-on assessment? If the answer is no to that, we can just forward the message, so the front desk staff, whichever member of the team is assigned that has access, can go in and look and see, okay, I can see that I can just forward this to the physician, and the physician can either respond through the front desk, or they can respond directly to the patient if they want to, maybe have some one-on-one conversation about that. And that's where you see the billing codes for things like O301S and O301AD. If they do need to come in or be seen virtually, then the front desk can send an appointment time, send any prep forms that are appropriate, and collect that information in advance. And we see clinics that do that collect the information in advance. They actually have been able to, in some cases, cut their appointment time in half, because the physician now is coming to that encounter with the patient with a lot of the information they need. So some of that upfront investigation is already done, and they can sort of dive more detailed into what's going on. And a thing like that, so if we're looking at a video consult or phone consult, these are some of the codes that would apply that we talked about that are listed there. So 301AD still, 0303CV, that sort of thing. And then if there is afterwards some consult required, that's where we get into things like O301R, sending an e-consult to a specialist. Or you can also use secure mail after that to sort of order services. We have clinics that use it with pharmacies. We have clinics that use it with imaging services, that sort of thing. And then once you get an e-consult back in response, you can address it to the patient and say, hey, here's some interpretation, and here's my thoughts on this, and here's the expert advice I've gotten, and that's something that could qualify for O301S as well. So that's like a kind of a standard flow maybe of how things would work, and I want to look at the different aspects of your virtual care system that are going to be applied here. So, a routine request for a prescription refill. The patient sends a message to the clinic. Maybe it's 9:30 at night, and they realize, oh, geez, I'm almost out of these pills I take. I know if it's me, I forget to do that if I don't do it right away. So they send a message to the front desk team. And in the morning, the front desk looks at it. They say, okay, oh, yep, okay, Mrs. Johnson needs a refill on this. Forward it to the doctor. They might review and request review the request and approve it. They might want to do some follow-up with Mrs. Johnson, and if not, they can just sort of send the RX. They can do it, CC the MOAs, the front desk team, and they could send it directly to the pharmacy, or they could have the MOA do it, however that process is. And you can see here the technology that we're using in your virtual care stack. You got your secure mail and your EMR kind of all the way across at each step, because the doctor can get the secure mail message request, look at Mrs. Johnson, find the notes in the EMR, or the front desk can take care of that and say, here's all the information, what do you want to do? And then afterwards, notify the patient, mark, annotate the patient file as well. We can get that done pretty quickly. And you can see there what's kind of nice about it is there's not a lot of phone traffic. So we're not doing the phone calls back and forth. We're not necessarily scheduling an appointment with the patient unless absolutely necessary. So we look at here sort of before, during, and after the visit. A patient might request an appointment. So they can message. I know some clinics will receive sort of intake requests for an appointment and then call the patient back and say, okay, here's the time we have for you, and they can do that. They can also send questionnaires, check and see if any imaging is done, what tests they need to have done, and send that out beforehand. If they need to send any recs to the patient, that can all be done through secure mail. Anything that would have been mailed before or using paper, clinics can do that this way instead. And we do have clinics. We were on a call yesterday talking about this. There's a bunch of clinics we know that have saved a lot in terms of consumables, and there's one clinic that we work with that has cut $1,000 a month out of stamps and printing, just by sending things digitally through secure mail as well, because you can attach really any file that you need to a secure mail message. So you can see here what we're doing is we're doing secure mail on the EMR up front and some phone in there too, just to confirm the appointment and give them some times. And then, we're doing a virtual care visit over phone or video conference. The physician is involved in that. We provide maybe the patient some instructions up front. Here's how to use the service. Here's what to do with it. And then after the visit, we can send up follow-up notes, treatment notes, a plan, that sort of thing. And a follow-up message to the MOA, hey, can you make these notes in the patient record? So, one of the biggest questions we get is, when I implement secure mail and give patients access to my clinic like this, are we just going to get buried? And the answer is really absolutely not. And here's a quote from Dr. Jutefree. And their clinic, really, they do invite all of their patients as they onboard. They're a specialist clinic. Any patient that shows up at their clinic gets invited to use secure mail with them so they can ask questions and receive all of their records. And what they've seen is that they're very respectful of physician time and availability, that they're not getting inundated with high demands for questions. And Kaiser Permanente has done research on that too. And what they've shown is that patients are not inundating clinics with messages. We know that, patients aren't sitting by their keyboard waiting for that opportunity to email their clinic every 10 minutes. From a patient perspective, it's quick, allows for communication, doesn't really need an office visit. Patients don't always want to go to the clinic, especially now. They want to be able to send their questions off and get responses as quick as they can. Or without having to travel, without having to align schedules, take time out of their day. I know for me personally, trying to squeeze things in between my own meetings and in the day right now is pretty tough, and I'm not actually allowed to leave my house, so this is very helpful. So I mean, that's really kind of it's the overview. If you have any questions about it, certainly give us a shout. We do have the questions tab. We're coming close to the end of time for us right now, but if you have any questions, certainly submit them. And if you have any questions about privacy, you can go to brightsquid.com. We have our privacy support that we can help out with. If you want help updating your PIA so that you can implement this stuff, we will support that. And right now, any medical clinic in Alberta qualifies for a free secure mail account up until the end of July, just so we can help support social distancing through the pandemic. You can go to the website, click on the COVID-19 support for clinics button right there in the top banner of our homepage, and that'll take you to a page that has a form where you can request an account. We'll be running regular training sessions. So that's it for today. hopefully that was helpful. Any questions, always contact our support team. If you haven't signed up for your account yet, just go to the COVID-19 Support for Clinics page, and we'll get you set up with your free SecureMail account and help you onboard and get set up with your virtual front desk. Thanks for tuning in, everyone.